and services for HIV, sexually transmitted infections and tuberculosis, among other illnesses. Well, Dr. Ramneek Ahluwalia is the Director of Higher Education and Training, HIV/AIDS program, and he joins us now on the line from Pretoria. Good afternoon, Doctor. Are you with us now?
Good afternoon, Kirshni. Thank you.
Coloured and scented male condoms in the public sector now, and rebranding in the process. We understand this is to increase the use of protection by young and older people. But there is something worrying emerging in that we see an increased number of young people having unprotected sex and getting infected. They do appear to be relying on the fact that there is ARV treatment available should they become infected. How do we get around this dangerous mindset, Doctor?
So I think Kirshni is totally right. I believe this new intervention the Minister has launched yesterday, which is the coloured and scented condoms, we're hoping that, because we all know that condoms are the best protective methodology we have against not only HIV but sexually transmitted infections, which we as all know that they are the leading cause of breast and cervical cancers now and other cancers, plus also teenage pregnancies. So I think besides sexual absenteeism, which is not having sex, the second best remedy we have is condoms. And making condoms more attractive, probably we are hoping that the usage of condoms will increase. And of course, the reliability, exactly what you're saying, that people are now thinking that ARVs are there and they will make longer. Definitely, yes. But the important stage at this moment is to stop new infections, because that's where the reality of the thing is. And I think this new intervention will help us.
All right. This isn't a new program, Doctor. You had similar such launches last year. What makes this one unique or different?
I think this year we definitely plan to put a proposal saying we'll definitely launch comprehensive package to combination prevention of HIV, TB, and STIs. When I say comprehensive package, means right from HIV treatment, care and support to screening to STIs to blood pressure, diabetes, TB, cancers, family planning, contraception, medical circumcision. You name a thing that is important as a basic health facility at the doorsteps of every young person. And this is our vision to provide it. And that's why it makes it different this year, because we actually supplying everything at the doorstep of the young people. And that's the reason why we requested the Minister to perform a live circumcision yesterday, as well as an intradermal implant, to send the message to every young person: we are serious, now we're providing it to your doorstep, please look after it.
Doctor, there's a new HSRC report that provides insight into young people's attitudes and behavior towards sex and HIV. Have we let our guard down a little bit in that people are living longer on ARVs, but there's still a need now to focus on prevention? We used to be more vigilant, but it appears that we are losing respect for HIV and the danger it poses to young people's safety and future.
We've got close to 7 million people living with HIV in this country. Still today, we have 1,000 new infections every day coming. Yes, I mean, ARVs is one of the best intervention we have at this moment that can make you live longer. And definitely we have to pursue this. That's why we have to test early, put you on ARV so that you live as much as a diabetic patient can. But the solution to the problem is we have to prevent new infections. And I think, and as you rightly say, we cannot let our guard down, because we as any government in the world will not be able to put every person on ARVs. It's so expensive. It's difficult for everyone to access it. But the reality of things is, if we can prevent new infections, if we can stop new infections, absolutely the burden of the disease falls down. And I think that's where our methodology has to be.
Dr. Ramneek Ahluwalia, the Director of Higher Education and Training, HIV/AIDS program, thank you for your time on the PM News.